Go team.
Welcome to the Medicare Cafe. My name is Olivia Richardson.
And I'm Mike, and today we're talking about certification and a little bit more. Because certification takes about 4 seconds. You should be certified. Okay.
Done. Moving on. But it is something, again, right now, we did a huge certification push. Senior marketing specialist did yesterday. And they mentioned that a lot of the team members on the phones were like, got laughed off the phones because people were like, yeah, I know I need to certify, but I have time. Girl, you really don't have time. United Healthcare shuts down their pre-order of their supplies in less than 2 weeks, August 14th. So you really don't have the time that you thought. We're also seeing a ton of small regional carriers come into the market now that we do have the sneak peeks. For most of them, we're starting to see like, oh, shoot, maybe you should get contract with this. Oh, maybe you do need to add this to your portfolio. And so now you're having to fill out contracting and do certifications at the same time. So just get it done.
Yeah. Because unlike the IRS where you could file an extension, you can't do that with certification. It's like, you know what? I wasn't certified, but a good show came on Netflix and I really wanted to marathon that and put it off. And they're like, yeah, this was the limit for everybody. Sorry.
Oh, and that's a good point. A lot of carriers have now rolled out certification cutoffs to where if you're not certified by a certain date, then you're not going to be certified for that entire year. In addition to that, there's cutoffs for being able to receive renewals. And sometimes if you don't certify, you don't get those renewals the entire year. So making sure that you get those out of the way now. Again, Senior Marketing Specialist is launching a program. You can win a $50 gift card. They're going to be drawing 5 names. That you can get a $50 gift card for every carrier that you have through Senior Marketing Specialist that you're ready to sell. Put your name in that drawing. So the more carriers you have with us, the more carriers that you're certified with, the more chances you have to win one of the 5 $50 gift cards.
Bingo. And it has to be done, like we said. And the hard part is when you're certifying for all of 2022. A lot of agents, I think, look at AEP and go, okay, I'm not going to do this in AEP. I probably won't sell that plan in AEP. I'm not going to do anything in AEP with this, so I'm not going to certify for it. But you have to remember, you're certifying for all of next year. So what opportunities are you going to have next May? Do you know? No. So put yourself in a position to say yes to business next year and not short sell yourself in AEP because you weren't going to do it in a couple months.
Oh, yeah. No, for sure. And that's something, again, I think a lot of agents, for good reason, because you do them every single year. They're cumbersome. Everybody hates certifications. But are you making the most out of your certifications? I think doing those are a great marketing ploy. And I see a lot of agents utilize this. But all these certifications, you get a certificate. You get something that's printed that you can print out and have there. I would be hanging those all over my walls and saying, like, I have completed my continuing education. I am up to date. I have studied. I've done my research. I've done all the heavy lifting. So you should feel comfortable trusting your insurance purchases through me, because look at all these certifications. I have to do these every single year. I got them done. I got them out of the way. Just posting them on your social media saying like, hey, just completed my certifications. I'm ready to serve you this AEP. Again, there's a lot, obviously it's annoying and obviously we don't want to do them, but it is something that you could be doing a lot of marketing around to, again, just kind of building that, what's the word, not compliance, starts with the C though, confidence, having confidence in, having clients having confidence in you.
Yeah, and you have to do them. That's the other side of it. You have to do them. And
but you have to, so make the most out of it.
Yeah. If life hands you lemons, make a vodka lemonade.
Find somebody who had vodka.
Yes, exactly. Now, the other part of this is after you're done certifying, make sure your contracts are up to date for all your ancillary products, because HIP and DVH sell perfectly in AEP because you've got the scope of appointment still will be gone in a couple of years. We hope so, but it's not yet. So let's sell out what we have at our feet and not what we hope happens down the road.
Again, make lemonade. You have to have a scope of appointment. The scope of appointment, though it is just kind of a road, not a roadblock, but maybe a road bump. Utilize it as a marketing technique. The scope appointment is one of the best cross-selling tools you're going to come into. Highly recommend that you start utilizing, if you're not, then begin utilizing the scope of appointment option on Medicare Center. It allows you to do both a text and an email option, and it stores the scope of appointment for 10 years. So utilize the system that you have in place, get those done and out of the way. It makes it just the whole process easy.
So you want to make sure you contracted or get the process started now, because it could take 2, 3, 4 weeks to get it done. You don't want to try start doing it the last couple weeks of September. So
Mhm.
the first couple weeks of AEP, when you're out there trying to enroll people in hospital indemnity, like, I'd love to sell you this hospital benefit, but I don't have my shit together yet.
It's you
And I
have
just
yeah.
swore. So I just,
Aw,
it just
you
kind of came right out.
you do have to make sure that your systems and processes are ready to go now. If you're wanting to
Yes.
incorporate something new for AEP, maybe you want to try Medicare Center, maybe you want to try the texting option, maybe you want to try just a new office protocol. Start that now, get into that habit and routine now, so when it comes to AEP, it's one less thing to be stressed about.
Yeah, because it's harder when you have your busy season and when you're trying to contact the most people, i.e. your entire book of business, whether it be a client, prospect, or lead, trying to orchestrate all of that with a new procedure can be very disastrous.
For sure.
Now, if it's a smooth operation, smooth
Okay.
operator. Yes. If it's smooth, then it can make your life so much better. So now's the time for trial and error. Now's the time to make sure your certification is up to date. All your ancillary products are up to date. Your portfolio is ready to go long before AEP hits. So if there's a hiccup in the road, you could address it now and not in the middle of a sale and possibly, interrupt that sale and make it not happen because of something that you didn't foresee coming. Get all the bumps on the road now.
You got to make the easiest path to yes. And the easiest path are smooth transitions, making the process seamless. You can only do that with practice. So get that started now. Get your prepping starting now. And prep starts with completing your certifications.
I will say,
I would like to know why, while Mike's finishing that point,
ahead.
Why, if you haven't done your certifications yet, why not? If what we're saying now is just like, girl, go away. I know I need to do them. I got time. Tell me, why have you not done your certifications?
Yes. And I will say for the people that are going to stay put, because like Olivia said in the beginning, I read that too. This year is going to be pretty much a maintenance year. You have some disruptions in some markets as we do every year, but most markets are pretty much business as usual.
There's a lot of expansions. If I'm looking at you, Nebraska, if you're in Nebraska, one of the more rural areas, you got some plans coming for you.
Yeah.
Besides the point, other than Nebraska.
Yeah. If you're going to do maintenance, which means a lot of clients are just going to be, okay, I'm staying put for next year, you can still offer them hospital indemnity or dental vision hearing. Even if they have a benefit-rich MA plan, that doesn't mean they don't need teeth extracted or something else that their MA plan is going to fall short on, and then you have this come in on the tail end and greatly reduce their out-of-pocket exposure at the dentist. So there is still opportunity to talk to all your clients and prospects about something. It's a matter of how good you are as an agent.
Also, right now, keep in mind the rules have been tweaked slightly in the past couple of years that you can now mention the dates of the annual enrollment period prior to October 1st. So if you are going to be putting out Facebook posts or mail out to your current book of business, you can't. I don't think you can set appointments. Can you?
I don't know. I think that's still a gray area.
You can start talking about the dates, though.
You can start talking about the dates of AEP. You could set up appointments for annual reviews.
Yeah.
So there's some gray area to work in that CMS hasn't really defined. And that's part of the challenge of compliance is CMS sets the rules, and then we're all left to interpret them.
Yeah.
So some carriers may be more lenient, like, yes, you can set appointments. Others may be like, nope, you can't. I would say you could set up your generic annual review appointments and mention that Medicare open enrollment is October 15th, December 7th. That's something, another point is, do you call open enrollment or annual election? Because Medicare calls it open enrollment, even though open enrollment is January 1st to March 31st, but that's only for MA plans.
Yeah.
So
I call it, I say annual, and I think, it does, Medicare does refer to it as AEP.
So our stuff. But what about the public facing stuff? A lot of times they say open enrollment is.
If you look at the Joe Namath ad, they say annual as well.
Yeah, so it's up to you. I would say whatever Medicare's website phrases it, you can use that. So if Medicare calls it open enrollment, call it open enrollment. If they call it annual enrollment, either one's fine. It's just it's really semantics.
Yeah, in my opinion, I would absolutely differentiate between annual and open. Again, not that it really, I think you're splitting hairs here. I don't think the general public really cares, but whenever there is going to be some significant advertisement during OEP of like, there's still time, even though technically that's not allowed.
Yeah.
It is nice to make sure that you can differentiate and explain the differences, because you don't have the same rules during OEP as you do during AEP.
Exactly.
So it's a good reason to kind of differentiate what you're allowed to do.
Yeah, I would start putting together your letters now, saying, you know, annual enrollment is coming up, blah, 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 blah. So if you need help with that, definitely let us know.
And again, if you do need help with that, we have something in the AEP toolkit where you can, again, letters that can go out to your current book of business. They cannot go, or they shouldn't go to anybody who is not a current client of yours. But in the AEP toolkit, there are marketing materials you can use to tell a person you can hang tight, or, hey, you probably want to change plans. There's options that we need to discover in your area.
You need to be using those. So I'll give you an example here of something that with the stable market is that I think a lot of agents think they have more work than they do, because your BOB, your book of business, let's say you have 300 clients, 200 MA, 100 Med Sup with Part D plans. If the majority book of your business is going to stay put, right? 150 MA clients stay put, 75 of your Med Sup clients / Part D are staying put, right? So that's the majority is staying as is. If you are in 4 appointments a day for Monday through Friday, you'll be done by the end of October. So what are you gonna do in November and early December to fill your time of AEP?
Panic.
Yeah, so we're seeing a much more stable year. You need to start thinking about, okay, I can see all my current clients. What do I do with everyone else that are going to change? So I need to start running appointments for my other current clients for that hospital indemnity sale or that DV8 sale or a cancer sale. If you're going out there to say you're staying put, you're technically not an MA presentation. You could offer cancer plans, final expense,
For sure.
other ancillary products. So keep that in mind. And I would definitely have a plan for that when you're looking at AEP, to think, okay, I've got 2 weeks of running around changing clients. What am I going to do the rest of the time? High five. Yes. Yes, thank you.
Sorry, I got the yawns.
Yeah.
So that is what we have again, prepping for AEP. The beginning of prepping is completing those certifications. And here's another thing, guys. If you have an agency, please make sure your downlines and that you're providing resources for your downlines to certify. Every single year, the number one compliance violation that we see, again, we represent thousands of agents across the United States. The number one compliance violation we see is writing when you're not ready to sell, writing a product you're not certified for, writing a product that you're not licensed and appointed in. That, again, by far the number one compliance violation that we see. So please make sure.
Do you get commission on that?
No commissions on that. You are not agent of record, and you get a significant slap on the wrist from United Healthcare. You do it several times, you could be facing potential termination, and the very least, you're getting significant training on that. So please make sure that you are licensed, ready to sell, and you have your certifications completed, you and your entire agency, because again, it is overwhelmingly the number one cause of compliance violations.
Yeah, and there are separate certifications for DSNP and CSNP, correct?
DSNP and DSNP, and it depends on the carrier.
Right.
Every carrier does it a little bit differently, but for the most part, DSNP and CSNP are together, but they're separate from just your standard Medicare Advantage.
And again, even if you think to yourself, I don't sell Medicaid at all, but you'll never know when you come across a client that says, yeah, my sister, she lives on the other side of town, she has Medicaid, is there anything you can do to help her? I've had that happen numerous times, and you want to, again, put yourself in a position to say, yes, I can help her. So
yes,
yeah. So let's say she's a new MA. What is that? $500+?
More than that now.
Yeah. So you certifying something one a year for $500, that's worth it.
It's worth it.
Yeah. Or even if you're just switching her to a different plan, at least one, you're giving yourself service to that current client, expanding your book of business, and just a lot more opportunity, especially with CSNP as well, because that's when you run across people that, yeah, I have heart failure. Oh, well, now we have another option. Do you want a regular MA plan or a CSNP plan that focuses on heart conditions? Oh, let's talk about that. So if you don't have that option, another agent can easily come in the house and steal your business.
Again, please keep in mind, guys, if you do.
What's up?
Oh, serious. Just
Yeah.
letting me know. If you do have any questions or comments on this, please let us know. But again, we just want to make sure you are doing right, you are getting paid, and you're getting credit for the hard work that you're doing, making sure that you are getting the full ready to sell. Ready to sell isn't just certifications, it is licensed and appointed and done all the bells and whistles.
A great question from Melanie that we get every year, and I encourage people to ask, would you ever recommend HIP to an original Medicare who has a sub? If so, what would the reason be? I am thinking about those with repetitive surgeries, as I have a client with major continuous surgeries. You know what? I think that's definitely a case by case basis. And if you see someone that's maybe they need additional help at home, a hospital indemnity plan, because it's an indemnity style program, you could say, hey, you could take that money since you have a hospital bill, you could pay for home health care or home health aid to come in, or pay for transportation, or maybe refund your kids for taking off work, yada yada yada. It just gives them a pool of money every surgery.
Oh, for sure. And that is something, again, wow, words, Olivia. It depends on what's important to the client. Again, if the client wants some extra income during times where they're receiving surgery or during times whenever they're ill, they want that income, like Mike mentioned, to help pay somebody to walk their dog, to pay somebody to come in and clean their home, then that is absolutely something that's, worth it. Another thing you have to think about when it comes to hospital stays, if you're on MedSup or not, is observation care. When you're kind of in that midway point between you're in the emergency room, but you're staying overnight. However, you're not an inpatient. That observation care leaves a lot of questions unanswered. Last but not least, you have to be careful for medications that are considered maintenance medications, for sure. They're things like Tylenol, things like cough drops. Again, these are considered over the counter, but because they're given at a hospital setting, they're not covered by Medicare Part A, and they're not covered by the prescription drug side of it either. So maintenance medications like that can really rack up some dollars, and a lot of times those people have to pay for that out of pocket.
I think it's smart to offer it as something to consider. Maybe not a very soft approach to the client, and say, you know what, if you're worried about surgeries, now if they've already had a bunch of surgeries, they may not qualify health wise, and they may need a year or two gap depending on the carrier. But you go and say, hey, if you had a lot of surgeries coming into Medicare, and because GTL has that guaranteed issue 64.5, 65.5, it may be something I would do something to consider. There's a hospital benefit that does this, just something to keep in the back of your mind, and just plant that seed rather than actually offer it. Just plant the seed philosophy towards it. Because I've never sold one with a SUP personally. I sold a lot with MA plans, and GTL was the company I used because they were the first ones in the market to really push it with MA plans. But they
push it real good.
So there's nothing wrong with offering all the stuff you have to your clients. In fact, I think we made at one time like a little cheat sheet showing all the ancillary products that you could offer. I'll have to dig that up.
Sure.
I'm gonna write myself a note.
So again, join us this Friday. Mike is going to be talking about AEP prep and ancillary products, but that is Friday at 9 a.m. Central Standard Time. Go to our Facebook page. You'll see Mike join it there. If you're not on the Facebook page, make sure that you like and follow us so you can get notified whenever Mike goes live on there. Now, Deb asked a question or has a comment. Let me read this and put on
my
glasses.
Put on your double monocles.
My double monocle. I just had that steal happen last week. A lowish income MedSup client on a high deductible F that had been tempted before to switch to an MAPD finally went over to the S&P. Switched to an MAPD, finally went over to S&P carrying agent who had bells and whistles. And I'm sorry, my eyes are drying out.
Yeah.
Bells and whistles and a heart with diabetes and over-the-counter drug allowance, blah, 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 blah. That's something, again, that's, what used to be, hey, if you're not well, it used to be if you're high utilization, if you're not a well, healthy person, stick with the MedSup. And I still kind of believe in that to an extent.
Yeah.
Here's the idea when it comes to, they want a huge difference between MedSup and Medicare Advantage. Medicare Advantage is designed to keep you healthy. Medicare Advantage has over-the-counter medicines. It has, gym memberships, transportation memberships. Medicare Advantage plans are designed to keep you healthy. Medicare supplement plans are designed to help you if you're not healthy, or if you are not healthy. Yeah, I mean by what I say. What we've been seeing in the past 3 to 5 years is because Medicare Advantage benefits have been getting better and better because you're getting more and more income from CMS. We're really seeing Medicare Advantage benefits compete very strongly with the health benefits of a Medicare supplement. So not only are we seeing Medicare Advantage plans really focus on keeping people healthy, we're seeing a really significant improvement on benefits if somebody isn't healthy and has to utilize that. So right now, what I'm seeing for between Medicare supplements, Medicare Advantages is, do you want a network or do you not want a network? It's kind of, are you willing to pay money to see whatever doctor you want?
Right. And don't forget, you also have the guaranteed issue MedSup when they first are getting their Part B, and you have that MA test drive or that trial right. I just call it test drive of 12 months. So if they do go to an MAPD and you're like, I'm not happy with this, I want my MedSup back, you could always get it back for them.
Yeah.
So there's lots of options for your clients. And like Olivia said, it's these chronic condition special need plans are pretty, some of the markets are pretty nice. I know back in the day, Coventry had a really good diabetic one. That anyone that's diabetic, I said, you really got two roads. It's diabetic one, you get, your insulin's no cost, or go a MedSup route where your healthcare is just a copay, or not copay, a premium, and then you have to pay for your drugs. And all of them are like, I use my insulin every month. Let's go that route.
Yeah.
So.
Let's see. Melanie asked a really great question. She said that she was told that she can do a trial right anytime after 65. Is that still true? So there's two types of trial rights between switching from a Medicare supplement to a Medicare Advantage plan. The trial right 65. That is if when somebody turns and they first become eligible for Medicare upon turning 65, and upon turning 65, they roll into a Medicare Advantage plan. The first 12 months of that Medicare Advantage plan, they do have a trial right to switch into a Medicare supplement with a prescription drug plan. That's trial right 65. Yes. If you're somebody who delayed Medicare Part B, trial right 65 does not apply to you. Now, the other trial right is the trial right.
Say the last part.
If you are somebody who delayed Medicare Part B or did not enroll into a Medicare Advantage plan upon turning 65, that trial right will not work for you.
Yes.
On the Medicare supplement side, the trial right for Medicare supplement means that it doesn't matter if you delayed Medicare Part B, it doesn't matter if you took it out. The way that it works is that if you started, when you became eligible for Medicare Part B, if you started on a Medicare supplement plan, even if you had that Medicare supplement plan for 15 years, if you switch to a Medicare Advantage plan for the first time, you have a 12-month period after that Medicare Advantage plan goes into effect to switch back to that Medicare supplement. It has to be the same plan with the same carrier. So just giving you that option as well. So that's why you do have more flexibility, is if you start with a Medicare supplement plan versus starting with a Medicare Advantage. It does give you more flexibility.
Yeah, Michael brought up a great point, with multiple sclerosis or any other serious cancer diagnosis. With a MedSup, you have your choice of where to get treatment. With the MAPD, you do not. You're limited by that network.
It is. Well, and you say that, but we're starting to see a ton of investments in PPOs. PPOs mean that you can receive care outside of network at a higher cost. However, a lot, because again, the expansion of these benefits, you're seeing a ton of $0 out of network PPO costs, and you're seeing a ton of $0 deductibles for out-of-network costs. Again, that's in select counties, but you're seeing a lot more $0 PPOs and $0 specialist fees, copays in those PPOs now. So for sure, Mike, good to see you, Mike, or see ya, but for sure it does. Again, MedSups, typically, I'm still in the camp of sicker people, go MedSup route. If you want freedom, go MedSup route. If you are somebody who's very interested in staying healthy, Medicare Advantage as well.
Yeah, and to further that point, Melanie, if they leave their MedSup and that MedSup is no longer available, no longer marketed by another company, then they have the limited enrollment.
Yes. Okay, so that plan.
Was all right. Did I skip Porter real quick? I'll come back to you, Porter.
Yeah, if you let's say you enrolled into you have a client who's enrolled into an old Aflac MedSup that hasn't been around since 2013. If they still hung on to that plan, they're using the trial right, they obviously can't go back to the Aflac plan. Then they have the guarantee issues, A, B, C, F, K, and L. and yeah, they can get and any carrier as well.
Yeah, and Porter said that he has a MedSup and never had any problems with getting all the wellness tests from a doctor order. Yeah, MedSup, if you want the most control over your wellness, over your healthcare, MedSup's the way to go because you're not limited by networks or what doctors you can see. So yeah, absolutely.
MedSup is the freedom route. MedSup is the I don't like change. I like to know my budget. I like to know exactly what's going on. I want more control. I travel. That's going to be your MedSup side. Medicare Advantage, again, Medicare Advantage is going to be the I want the bells and whistles. I want one card to handle everything. I don't travel that much, but if I do, I like the comfort to know that I can still go see a doctor here and there. So for sure. And again, Mike and I, we will be doing a MedSup versus a Medicare Advantage webinar, Senior Marketing Specialist will, here towards the end of this month or middle of September. So for details to sign up on that, go to smsteam.net, click on the events tab, and that is coming up, a Medicare Supplement versus Medicare Advantage webinar.
Yeah, and Brad has a great question. Have an appointment tomorrow using a trial right for a 67-year-old. She tried to make her Advantage plan for the first time this year and wants to go back to her MedSup. How does her smoking affect her MedSup rates? Still gets GI with non-smoker rates. I believe
depends on the carrier.
Yeah, it's going to be carrier by carrier. Some may be, hey, just come on in. Others may be, ooh, you smoke.
And
well,
Brad,
we'll guarantee issue, but with these rates over here.
Yeah, Brad, I know that you're a Missouri resident, and so I'm assuming your client is Missouri resident. Missouri has a state regulation that technically, even if somebody is considered guarantee issue or in the open enrollment, Missouri does allow them to still charge tobacco rates.
Yes.
So that is a carrier question. Oh, it's a Kansas resident. So Kansas, they can't ask tobacco questions if they're guarantee issue or open enrollment. So
there you go.
There you go.
Yeah, makes it a lot easier. But stranger things have happened. So just make sure that I would follow that application through and double check with the client after she's approved, which you will be, and double check her rate to make sure everything's smooth. Just give that extra level of customer service to make sure she's doing it right. Because we have seen cases where people are paying the wrong rate, or they have a MedSup and an MA plan at the same time because they never canceled their MedSup. So now they're $2,000, $3,000, $4,000, $5,000 in premiums out the door because they forgot to cancel. So my one favorite quotes is always go the extra mile. It's really never that crowded. So
Deb, basically, and welcome to the independent side, Deb. She said that she's only been working with one carrier in the past. She's now starting to branch out and get with other carriers. Not sure what we mean by certifications. Certifications are required per carrier for carriers that sell Medicare Advantage and prescription drug plans. Many carriers will require a state or a test called the AHIP. You take the AHIP through those carriers, costs $175. If you take it through a carrier like Humana, Aetna, United Healthcare, they will give you a $25 discount. And that test does translate to almost all Medicare Advantage and prescription drug plan carriers. So if you're going to sell with United Healthcare, Aetna, WellCare, and Humana, then what you would have to do is first take the AHIP, probably take the AHIP through a carrier like United Healthcare, and then you would complete additional certifications per each carrier. Those certifications, in addition to the AHIP, are typically more just ethics and compliance, and they'll actually get into some product-specific stuff as well. So they're pretty simple. I'm not going to say simple. It takes a day, I would say. If you have multiple carriers, it can take a full day to actually complete them all.
Yeah, it's not rocket surgery, but you still have to know what you're doing.
So is it only required for MAPD and MedSup? Yes, it's only required for MAPD and PDP, except for United Healthcare. United Healthcare does have a MedSup certification, and then the carrier SureBridge for their dental, they have a certification as well.
Do you know what teeth are? Yes. Thank you for replying.
It's not a difficult certification, but it's still time consuming.
Yeah, I still have to go through it. Yeah, so great questions. I know the trial rights is one, just remember this trial rights vary per state. And not vary on what they could get per state, smoking or non-smoking rates. That's an excellent point. Also, double check and verify with the clients that that's their first time on an MA plan, because if they're 75 years old, they've had Medicare for 10 years, they may have tried the MA plan back when they, 9 years ago, had it for 6 months and left. Now, it's not their first time enrolling. So that trial right goes out the door. So you want to make sure your clients are telling you the truth. And how do you verify that?
Are you asking me how do I verify that? The only really way that you can verify that, mymedicare.gov should have
That's
that
what I'm thinking too.
information, or calling 1-800-Medicare.
Yeah.
But carriers themselves would not be able to pull up the system and say, well, they wouldn't be able to tell the agent that, hey, this isn't their first Medicare Advantage
Right.
plan.
So
They know it, but they can't tell the agent.
I like the idea of having your clients have a mymedicare.gov account because you get a lot of information from that.
You get a ton of information.
Yes. I think and Carol asked about that sheet, the ancillary product cheat sheet. I'm gonna find that and I will post it in the Medicare Cafe agent group as soon as I find it one day.
Perfect. Well, you guys have been fabulous. Again, make sure you
Yes.
join and like our Facebook page as well as our Facebook group. Make sure you check out Mike on Friday. He'll be going live at 9 a.m. on our Facebook page.
Yes. So until next time, have fun, make money, and
Give impeccable service. Thanks, guys.
thank you.